Okay, our next speaker, Viacheslav Mishiyev. Did I pronounce that right? This is a mental health, providing physiological and psychiatric care in war conditions.
Добрий день, шановні учасники конференції. Моя доповідь називається «Досвід надання стаціонарної медики».
My report is on providing assistance to soldiers during the wartime. I was asked to make a short informational report regarding practical aspects of provision of psychological psychiatric assistance to combatants and civil population suffering from the situation of war. So assistance with psychological support in condition of 3 years of full-scale war is very actual. Official and mass media are full of information with high increase of contacting psychologists during the war, which is more important. It will be true for many years after the war. The experience of psychiatric hospitals in Ukraine recently can confirm this information. So after the war, people like 15 million Ukrainians will need psychological support after war. As the complete data concerns Kiev, then in further report I will adhere to the biggest psychiatric hospital in Kiev with 13,000 beds, but this experience can be increased to all regional psychiatric hospitals of the country. So the dynamic of asking for psychological help has grown significantly, but in general the dynamics within last dozens of years looks like this. A decrease for psychological help both inpatient and outpatient during the liberalization of legislation, observation of psychiatric and mass attack on family and the publics in the beginning of 2000s. Next stage was a small growth of people with disabilities, stabilization and growth of disability, and the last period after the full scale is a significant growth both for psychological support and disability. Like the number of people receiving inpatient war in psychiatry per year was like 10,000 people. Then within the recent years, a year or two, this number of patients equals 14,000 of patients. This also concerns disability issues. If a person was specified with disability, mainly the children, and attendance to psychological help was considered as a torture, then after the war a great number of relatives addressed different medical expertise committees for psychological and other kinds of help that also relates to elderly people who had the need to establish their disability through the expert commissions. So this was a significant change where psychiatric hospitals had to be adapted to. The main group of requests from civil population who received emotional stress due to threats to their own lives or lives of their relatives and of course the soldiers. I need to signify that since first days of war, the hospital has a special department for specialized care for soldiers. The structure of diseases among the soldiers. I need to say that since the first months of war, our hospital, just like a number of city hospitals, have created military departments on different specialties like burns, surgeons, etc. And the same was made for the psychological help in Kiev. As right now I'm talking of the biggest psychiatric hospital in Kiev. We also created a special military department after an agreement between the MOD and the Department of Healthcare of the city. First, we opened a department for 40 beds, but every month the number of patients grew and we went up to 70. Recently, we have approximately 150 soldiers as inpatients. The structure of diseases of soldiers is principally different from diseases of the civilians. As you see in this slide, most part are the patients with PTSD, it's more than 50%. Second group is the organic damages, traumatic damages due to explosive wounds, different kinds of traumas, which is 25%. Another 25% is affects slums and obsessive conditions. Within February of 2022, our camp has been running more than 100 of medical military commissions to decide if the people are fit for further soldier service, and let's say 10-15% of soldiers are acquired as non-able, and that means that 80% of the soldiers go back to the service. So the normal term of the service of a soldier right now is for examination is like 20 days. The peculiarities of provision of inpatient psychiatric assistance to the soldiers, like material basis for the psychiatric hospitals in the country, still remains under-resourced. But firstly, for soldiers, our hospital has created good conditions for rehabilitation and treatment. The soldiers department in the hospital includes lots of specialists on rehabilitation and treatment. I mean, it was a reinforced team, especially for the military department of the hospital. Since the first days, the assistance to the soldiers, besides the high level of psychiatric psychological assistance, the hospital decided to arrange therapeutic arrangements with the patient. That's how we're keeping up with the schedules, where the working schedule of the soldier and the patients include tasks with psychotherapists and psychologists. These methods increase resilience to wrong factors. They correlate the personal traits. They release some muscle and abdominal pressure. It helps the soldier to come over the disease and increases the resistance to come over the disease. With volunteer help, we have a special room installed in our hospital. It's a hall with 120 square meters with different kinds of sports equipment. We also pay attention to art therapy. We consider that art therapy will help to distract the attention of the soldier and reconnect it to another types of activities, helps to know yourself better and relax. The patients are making different things, gifts, etc. They send to their relatives or other deceased. Hospital has a mini stadium where we provide different sports events and competitions on volleyball, football, basketball. Due to personal contacts of the head of the military department with the hospital management, it has been agreed that there is a contract with a local hippodrome, so soldiers, 5, 7 people in group, are attending horse therapy. They drive the horses, they take care of them, and it is a kind of therapy for them. In accordance with the contract with the central pool, the Olympic pool in Kiev, so 2 or 3 times our soldiers in small groups participate in different activities in the pool, and they take their therapy lessons and distract their attention from their diseases in this way. We arrange small plays and concerts. According with the order of the MOH and the Council of Veterans dated of September 1, 2023, on provision of trainings, on provision of psychological help and psychosocial support in crisis and traumatic events for employees of the hospital. What we mean is that we're a methodological basis to train the employees of other medical establishments in coordination with soldiers. That means that high level of psychological pressure uh, which the soldier goes through being wounded and having to stay in the hospital, in a civil hospital, means that the personnel needs special skills to communicate and establish the contact with such military patients. We've performed a social therapy. That's one of the establishments that provides assistance to people with obsessive conditions. That's a small psychiatric hospital in Kiev. So together we have developed training programs regarding skills for patients who participated in combats, basic skills of self-care, how to communicate during a war, psychological correction of stress disorders, social aspects of continuity of life. The tools for rehab programs are the slideshows, topic examples, video slides, etc. The final part of information campaign is the time when patients are asking questions, getting the necessary information on the topics above. Since September 2023 and up to now, so within a year, we've performed 24 trainings, which was attended by 220 doctors from 36 hospitals of the city. That's our small experience of provision of psychological help to the soldiers. I have done with my report. Should you have any questions, I'll be happy to answer. Thank you. Весьма что ли? Так.
Скажімо, у вашому центрі скільки людей можуть пройти?
How many people can have treatment for a year in your facility? You mean that general number? Yeah, how many per year? In general. As I told Bin, 5-7 years ago, before the war, there was around 10,000 patients. Now 14,000. 15,000 per year in your center. This is the hospital. This is the biggest hospital in Ukraine. But you said there is some requirements for 15 million. So what resources do you have? So how country can help you to cover all this number, 15 million? Interesting question, but very discutable. So I provide you the example. So our scientists provide 15 millions. I'm the practical doctor and scientist. I am not okay with that. So I think it's not 15 million. So when there is people who just write the numbers, they make these numbers out of the reality. And there is some kind of competition. Someone try to write 1 million. Another one say, no, let's sign 2 millions. And then 5, 10, 15. I'm against that 15 million numbers. 15 minutes. Not all of them need a patient care. You know, we have the very state program on the mental health. We collect the specialists. We have the volunteers who provide the care in this program out of the hospital care. So most of that help gonna be there. And answering on your question, this is the third year of the full scale. Now it's 14-15 millions of the people who need, but I think this is the limit. If we really have 15 millions, they already been in hospital. So 15 million, this is the limit. I hope this is the final call. If we're talking about the patient to our hospital, when the patient finish the treatment in your facility and goes to small village, who take care about that person after discharge? Our hospital and our principles of providing the cares, the principles of medical care in Ukraine, such every patient, every person can come to any hospital which is suitable for them. Who cares about the discharge? Doctors, medical persons. You mean when the patient? Can you verify the question? You have the experts. You have different type of therapy. If there is some people from rural and they don't have access to such kind of hospital, what they can do? Now, in Ukraine and in Kiev as well, and we can say it with a proud, there is some kind of social care. I think it even so they more provide help not about social care, they help different persons also for the patients. If there is a question how to provide the assist or care, social care, visit of the social workers visit at home the patient, they can do it. Our goal of the medical facility provide the medical care, provide recommendation, help the person adaptize to the life and discharge them from the hospital. This is our job. Thank you.